Okay, so today let's dive into something that I'm sure you encounter all the time as a GP, but maybe we don't always talk about very openly.
Right.
Female sexual dysfunction.
Yeah.
It can be a very sensitive topic,
It is.
and complex.
Absolutely.
And it really affects way more patients than you might think.
Way more.
So today we're on a mission to give you some solid information about how common this is,
Yeah.
the tricky web of factors that are involved, and just how to actually bring it up with your patients in a way that's helpful,
Right.
not awkward.
Yes, exactly. It's really about empowering you to spot those subtle signs and ask the right questions so that your patients feel comfortable enough to even start this conversation.
Exactly. Because here's the thing.
Yeah.
Nearly 40% of women worldwide say they have some kind of sexual concern,
Wow.
but only a tiny fraction ever actually seek help.
It's a huge problem.
So we're talking about like a massive silent struggle here.
Absolutely.
And GPs are really on the front lines to change that.
Yeah, I couldn't agree more.
So to effectively help these women,
Mm-hmm.
we need to start by understanding how things are supposed to work in the first place.
Right.
So you're probably familiar with the classic 4 phases of the female sexual response cycle.
Yeah.
Desire, arousal, orgasm,
Resolution.
yeah, the basics.
Yes.
But I bet it's rarely that straightforward in real life.
You are absolutely right. It's a great starting point,
Yeah.
but not a rigid checklist. Every woman's experience is different, and even the same woman will find that her response changes throughout her life.
So it's not like a step-by-step thing.
The key is to understand that satisfaction doesn't hinge on hitting every single phase, especially orgasm.
Okay, so ditching that orgasm is the ultimate goal
Yeah,
mindset.
absolutely.
That's step 1.
Exactly. It's really about the overall experience and individual satisfaction.
Yeah.
And of course, we can't forget about the emotional and relational context. Because sometimes, while desire kicks things off, often a woman's motivation for sex has a lot to do with things like emotional connection or strengthening the bond with her partner.
So it's about intimacy, not just the mechanics.
Exactly.
Okay, but hold on. We keep saying that this huge percentage of women are reporting sexual concerns.
Right.
What does that actually look like in practice? What are we talking about?
So there was a large-scale study in the U.S. called the Preside study, and they found that 43% of women reported at least one of the 3 main problems:
Okay.
low desire, difficulty with arousal, or trouble reaching orgasm.
So almost half the female population
That was huge.
walking into your office potentially dealing with this?
Exactly.
That's a staggering number.
Yeah.
But wait, does just experiencing a sexual concern automatically mean it's a diagnosable dysfunction?
That's a great question, and it's a really crucial distinction.
Okay.
So in that same study, only 12% of the women who reported those issues were actually distressed by them.
Yep.
And it's the distress, that negative impact on their life or relationships, that actually makes it a true dysfunction.
So it's not just about the symptom itself.
Right.
It's about how much it's bothering the patient.
Exactly.
Okay, and of course, we can't forget about painful sex, which I'm guessing a lot of women are too embarrassed to bring up on their own.
Absolutely.
Yeah.
And studies estimate that 16% of women experience pain during intercourse, and that's likely just the tip of the iceberg.
Right.
We, as GPs, need to be proactive in creating that safe space for them to talk about it.
This is really making me realize how important it is for us to be asking the right questions.
Yes.
But what actually causes these dysfunctions in the first place? It can't be as simple as just one single factor.
No, it's very rarely straightforward. Think of it as a web of interconnected factors, almost like a puzzle where each piece contributes to the overall picture.
Okay.
And we know that any serious medical condition can have a huge impact on a woman's sexual well-being, both directly and indirectly.
So it's not just the physical symptoms of the illness.
Right.
It's also the emotional and mental toll it takes.
Exactly.
Yeah.
And let's be honest, chronic fatigue and stress are practically epidemics these days.
Yeah.
Whether it's from work or family or even managing a health condition, those factors can really dampen libido even if everything else is fine physically.
It's the reality for so many of our patients.
It really is.
Okay, let's talk about maybe the elephant in the room here.
Okay.
Hormones, age, and menopause.
Yeah.
I feel like there are so many myths and half-truths floating around out there.
There are.
It's hard to know what to actually believe.
Absolutely.
What's actually true.
So let's start by debunking a really common one.
Okay.
Estrogen does decline during perimenopause and menopause, and this can lead to changes in sexual function,
Okay.
but it's mostly due to the impact on the vulva and vagina, what we
Yeah.
call genitourinary syndrome of menopause, or GSM.
GSM, right. So remind me what exactly happens there.
Essentially, estrogen is crucial for keeping those tissues healthy.
Right.
When the levels drop, you get dryness, thinning, inflammation, and even changes in the pelvic floor muscles.
Okay.
So then during sex, this can mean less lubrication, less vasocongestion. So that's that increased blood flow that causes swelling,
Right.
making arousal more difficult and leading to painful intercourse.
So that's the direct link to those pain disorders we were talking about earlier.
Exactly.
But it sounds like even though estrogen is important,
Yes.
it's not the whole story.
Not at all. While it plays a key role in GSM, menopause's impact on sexual function is much more complex.
Okay.
It's never as simple as just supplementing estrogen and calling it a day.
Yeah.
There's also a lot of discussion around the role of androgens,
Okay.
the male hormones.
Wait, androgens, I thought those were mainly a guy thing.
They are present in men at higher levels,
Right.
but women have them too, and they likely play a role in female sexual function, although the specifics are still being debated.
So women have them,
Yes.
but we're not totally sure what they do.
We don't. It's true.
Okay, that's confusing.
It is. And here's another interesting tidbit. Androgen levels don't always match up with sexual function.
Oh, really?
For example, women with PCOS who often have higher androgen levels don't necessarily report any benefits in that area.
Interesting. So it's definitely not as simple as like more androgens equals better sex.
No, not at all.
Got it.
And then we have age itself, which is very hard to separate from menopause
Right.
and all the other life changes that tend to happen as we get older.
Mm.
But one surprising thing the Prevalence study found was that while all types of sexual problems increased with age, the ones that caused the most distress were actually most common in women aged 45 to 64.
Oh, wow.
Not those 65 and older.
So midlife is actually when things are most bothersome for women,
It seems that way.
not later in life. That's fascinating.
It is, and it tells us it's not just biology, but the psychological and social aspects of aging, too.
Okay, so we really need a holistic view here.
Absolutely.
Considering hormonal shifts, relationships, mental health, and the woman's individual life circumstances,
All of it.
it's like detective work putting all these pieces together.
Yeah, it really is.
Okay, but let's move on to the actual diagnosis of female sexual dysfunction.
Yeah.
How do we formally define this in a way that's helpful in a clinical setting?
Well, the guidelines lay out some specific criteria.
Okay.
So for a sexual problem to be considered a dysfunction, it needs to be recurrent or persistent, meaning it happens often and doesn't just go away.
Okay.
And crucially, it has to cause the woman significant distress or interpersonal problems.
So there's that emphasis on distress again.
Yes.
Okay. And these symptoms have to be present for at least 6 months and not be better explained by something else like depression. Right.
You got it. The guidelines categorize these dysfunctions based on which part of the sexual response cycle they mainly affect, although in reality things are often messier, with women experiencing issues across multiple phases.
So those neat little categories are more for our purposes, like organization,
Exactly.
than how things actually present in the real world.
Precisely.
Got it. But just for clarity, can we break those categories down?
Absolutely. So first we have female sexual interest arousal disorder, which combines what used to be separate categories for low desire and arousal.
Okay.
And it's characterized by a lack of or significantly reduced interest in sex or difficulty getting aroused even with erotic cues.
So we're talking about things like
Yeah.
decreased interest in sex, fewer sexual thoughts or fantasies, and not getting aroused even when they want to.
Exactly. And this has to be consistent across most or all sexual encounters, regardless of the situation or partner.
Okay, that makes sense.
Yeah.
What about the other categories?
So next is female orgasmic disorder, which is pretty self-explanatory.
Right.
It involves either a marked delay in orgasm, infrequent orgasms, or not being able to orgasm at all, even though they have normal desire and arousal.
The engine's running,
Yes.
but they can't get to the finish line.
I like that. A good analogy.
Yeah.
Again, this difficulty needs to be consistent across most or all sexual encounters. Then we have substance medication-induced sexual dysfunction, which recognizes that certain medications or even recreational substances can really mess with sexual function.
So if a patient starts a new medication
Mm-hmm.
and suddenly has sexual problems, that's a big red flag to investigate.
Absolutely.
Okay.
And finally, we have two catch-all categories. other specified sexual dysfunction and unspecified sexual dysfunction.
Okay.
These are for situations where a woman is definitely distressed about her sexual function, but it doesn't neatly fit into those other boxes.
So it's about acknowledging that there are always nuances
Yeah,
and individual variations
of course.
in how this manifests.
Exactly. It's about validating her experience, even if it doesn't perfectly match a textbook definition.
Yeah.
And remember, these diagnostic categories are just tools to help us understand and address her concerns, not labels to slap on her.
Well said. That really highlights how important sensitivity and a patient-centered approach are when we're talking about these issues. But now let's get practical. How should a GP approach evaluating a woman who might be struggling with sexual dysfunction?
Well, the first and arguably most crucial step is to create an environment where she feels safe and comfortable enough to even bring up these sensitive topics,
Okay.
which can be harder than it sounds.
You're telling me, how do we actually do that in a busy clinic setting?
Right. Well, start by routinely incorporating sexual health into every comprehensive health visit, not just when a problem is obvious. Simple, open-ended questions like, do you have any sexual concerns you'd like to discuss? Can go a long way.
It's about normalizing the conversation,
Exactly.
making it clear that these are legitimate health concerns.
Yes.
But what about time constraints?
Right.
We all know those 15-minute appointments just fly by.
I hear you. Time is often limited. But if a patient does bring up concerns and you can't dive deep in that moment, at least acknowledge their importance and schedule a dedicated follow-up specifically to address them.
Okay, so it's showing them that you're taking those concerns seriously.
Yes.
Even if you can't unpack everything right then and there.
Exactly.
Okay, and when you do have the time for more detailed discussion, taking a thorough sexual history is really crucial, right?
It is.
Like asking specific questions about the nature of the problem, when it started, any possible triggers, how it's impacting their quality of life, their relationships.
All of that.
So we need a good roadmap to guide us through this sensitive conversation.
Yeah.
Is there any resource that you recommend?
Actually, there's a really helpful table in our materials today
Okay.
that outlines key questions that can be incredibly insightful.
Right.
And these cover things like the specific symptoms, how often they occur, associated pain or discomfort, how it affects their desire and arousal, their past sexual history, any relevant medical or psychological factors.
That sounds like a gold mine of information. But what about a physical exam? Is that always necessary?
While a pelvic exam isn't strictly required to diagnose most sexual dysfunctions, it's only necessary for those involving sexual pain. It's still a good idea in most cases to rule out any underlying physical causes or abnormalities.
So it's as much about gathering more information as it is about reassurance.
Exactly.
Okay. Now, what about lab testing? Are there specific tests that we should be ordering routinely?
You know, there's this common misconception that we need to run a bunch of androgen tests to figure this out.
Okay.
But the truth is, the evidence doesn't support this practice.
Really?
Those serum levels don't consistently correlate with sexual function in women, and the tests themselves aren't always reliable.
So skip the blanket hormone panel.
Exactly. A personalized approach is much more valuable. Consider their medical history, mental health, relationships, lifestyle. The whole picture, not just one piece of the puzzle.
That holistic view keeps coming up.
It does, doesn't it?
This has been incredibly insightful, but we're reaching the end of this first part of our deep dive.
Okay.
Before we move on, what are the key takeaways you want our listeners to really remember?
Okay, firstly, never underestimate how common these issues are. Even if women aren't openly talking about them, it's our job to create that safe space.
Yeah.
Secondly, diagnosing these dysfunctions is about understanding the impact on the woman's life, not just ticking boxes.
Right.
And finally, always, always approach this holistically.
Fantastic points. We'll be back after a short break to dive into treatment options and some more practical advice for GPs like you.
Sounds good.
Welcome back to the deep dive. So we've laid a really solid foundation, understanding how common female sexual dysfunction is, the crazy array of factors that contribute to it,
Yeah.
and how to even start those crucial conversations with your patients.
Right.
But now let's get to the part you're probably most eager for.
Okay.
What can you actually do to help these women?
I'm glad you asked, because that's where the real empowerment comes in. And the first thing to emphasize is that there's no magic bullet,
Okay.
no one-size-fits-all solution. Management of female sexual dysfunction requires a truly individualized strategy, taking into account each patient's unique circumstances, needs, and goals.
So toss out the cookie-cutter approach.
Exactly.
Embrace the beautiful complexity of each patient.
Absolutely. Now, let's dive into some specific treatment strategies. One of the foundational pillars is addressing any underlying medical or psychological conditions that might be fueling the fire.
That makes perfect sense. If
Yeah.
someone is grappling with a chronic illness or mental health challenges,
Right.
it stands to reason that those need to be addressed
Yeah.
before we can expect much progress on the sexual well-being front.
Exactly. Think about it. If a patient has uncontrolled diabetes or hypertension, getting those conditions under control could improve blood flow and nerve function,
Okay.
both essential for a healthy sexual response. Similarly, if a patient is struggling with depression or anxiety, treating those with therapy or medication can often boost their mood and energy levels, making them more open to intimacy.
So it's about recognizing that sexual health is really woven into the fabric of their overall well-being,
Yes.
not some isolated compartment.
Couldn't have said it better myself. Now, another crucial piece of the puzzle is lifestyle modification. We already touched on the libido-crushing effects of stress and fatigue.
And those are practically unavoidable
Right.
for many people in today's world.
Sadly, yes. So encouraging your patients to adopt stress reduction techniques can make a huge difference.
Like what kind of things are we talking about?
Think mindfulness, meditation, yoga, anything that helps them unwind and de-stress.
Mm.
And of course, the trifecta of good sleep, regular exercise, and a healthy diet
Right.
can't be overstated. All of those contribute to better energy levels and overall well-being, which will naturally have positive ripple effects on their sexual function.
These are all things that we routinely counsel patients on anyway.
Right.
But it's worth emphasizing their importance in this context as well.
Absolutely. Now, for some women, especially those experiencing GSM due to menopause, hormone therapy might be an option.
Mm.
Remember how we talked about estrogen's vital role in maintaining the health of the vulva and vagina?
Right. And when those levels plummet, it can lead to all sorts of discomfort during intercourse.
Exactly.
Dryness, thinning, even pain.
It's true.
Not exactly conducive to a fulfilling sex life.
Not at all. So in these cases, localized estrogen therapy can be a game changer.
Okay.
We're talking about creams, tablets, or a vaginal ring that deliver estrogen directly to the tissues, restoring moisture, elasticity, and reducing discomfort.
Sounds promising.
Yeah.
Are there any risks or downsides to using local estrogen therapy?
Well, like any medical treatment, it's not without potential risks and side effects. It's crucial to have an open and honest conversation with your patient, weighing the benefits against the drawbacks.
Okay.
Systemic estrogen therapy, taken orally or via patch, might also be an option, but that comes with its own set of considerations, particularly cardiovascular risks, especially for women with certain pre-existing conditions. So it's definitely a decision best made in consultation with a specialist.
So personalized decision making,
Yes.
considering that individual patient's risk profile. Okay, got it.
Yeah.
Now let's talk about something a bit more controversial. The use of androgens in women.
Okay.
We touched on this earlier, that their exact role in female sexual function is still a bit murky, and the evidence for their effectiveness is mixed.
It's definitely a nuanced area, and I know there are concerns about potential side effects, given that androgens are typically associated with male characteristics, things
Yeah.
like acne, excess hair growth, or even voice deepening. Those are valid concerns.
So it's not a decision to be taken lightly.
Absolutely not. While androgens might help some women who are struggling with low desire, that potential for virilization is a real concern.
Right.
And it's important to remember that androgen therapy isn't currently FDA approved for female sexual dysfunction. So if you are considering this route, it's essential to involve a specialist.
It sounds like it requires careful consideration
Yes.
and close monitoring.
Absolutely.
Okay, so we've covered medical and hormonal interventions,
Right.
but it seems like we'd be missing a huge piece of the puzzle if we ignored the psychological and relationship aspects.
Yeah. You're absolutely right. For many women, addressing these aspects is just as critical, if not more so, than any physical treatment.
That makes sense. If someone's constantly stressed, anxious, or struggling in their relationship,
Yeah.
it's hard to imagine them feeling relaxed and receptive to intimacy.
Exactly. And that's where therapy comes in. Individual therapy can be incredibly helpful for women to explore their thoughts, feelings, and beliefs surrounding sex.
Okay.
It can help them address past trauma or negative experiences
Mm-hmm.
and develop healthy coping mechanisms for stress and anxiety.
So it's about creating a safe space to kind of unravel those deeper emotional threads that might be tangled up with their sexual difficulties.
Precisely. And for couples, relationship counseling can be transformative.
Yeah.
It can help improve communication, resolve conflicts, and rekindle that sense of intimacy that might have faded.
It's about strengthening the foundation of the relationship, which can then pave the way for a more fulfilling sex life.
Right. And for some women, sex therapy might be particularly beneficial. This specialized type of therapy focuses specifically on sexual issues,
Right.
providing guidance on techniques to improve arousal, communication, and enhance pleasure.
It's like physical therapy,
Yeah,
but for sexual function,
I love that analogy.
helping women to kind of retrain their bodies and minds to experience intimacy in a more positive way.
Great way to put it. Now, I know we see a lot of ads for over-the-counter products and devices marketed to boost female sexual function.
Oh, yeah, those are everywhere. Do they actually work? Should we be recommending those to our patients?
Honestly, the evidence for their effectiveness is often lacking or very limited.
Okay.
It's essential to advise your patients to be cautious about the often inflated claims made by these products. Some, like lubricants, can be helpful for managing vaginal dryness, but many others might not live up to the hype.
Right.
It's always best to have them discuss any such products with you before trying them.
So stick to the evidence-based approaches.
Yes.
Be wary of those quick fixes that sound too good to be true.
Exactly. And remember, the most effective management strategy often involves a combination of approaches, carefully tailored to the individual patient. It's about addressing the physical, emotional, and relational aspects holistically. Think of it as a multi-pronged attack,
Yeah.
targeting the dysfunction from different angles.
This has been an incredible overview of the treatment landscape. Really empowering stuff.
Good.
But before we move on, are there any other pearls of wisdom that you want to leave our listeners with? What should every GP keep in mind when approaching this topic with their patients?
I'm glad you asked, because this is where the art of medicine meets the science.
Yeah.
First and foremost, remember that patience and empathy are your greatest allies. These are sensitive issues, and many women might be hesitant to open up.
Right.
Creating a safe, non-judgmental space where they feel heard and validated is paramount.
Yeah.
Second, never underestimate the power of simple reassurance. Many women feel alone in their struggles, and simply knowing that their concerns are common and treatable can be incredibly empowering. And finally, don't hesitate to refer to a specialist when needed. Gynecologists, urologists, endocrinologists, and sex therapists can all play a role in providing comprehensive care.
Those are fantastic points. It's a reminder that treating female sexual dysfunction goes far beyond just prescribing a pill or recommending a procedure.
Right.
It's about listening deeply, understanding their unique story, and providing compassionate, holistic care that addresses the whole person.
Couldn't agree more.
Welcome back to the Deep Dive. So we've covered so much ground already,
We have.
from understanding the female sexual response cycle to the web of risk factors,
Yeah.
that whole treatment toolbox.
Mm-hmm.
But before we wrap up, I feel like there's this bigger, almost invisible layer that we haven't fully explored yet.
You're absolutely right. We focused on the individual, her
Yep.
biology, her psychology, her relationships,
Right.
but we can't ignore the very powerful influence of societal and cultural norms
Yeah.
that really shape how women experience their sexuality.
Mm-hmm.
And by extension, sexual dysfunction.
It's like this invisible backdrop that's influencing everything without us even realizing it.
Exactly. Think about it. For many women, societal expectations and cultural norms can create immense pressure to conform to certain ideals of femininity and sexuality.
Right.
Ideals that might not resonate with their own desires and experiences.
Yeah.
And this disconnect can lead to feelings of shame or guilt or a sense of inadequacy, making it even harder to acknowledge and seek help for sexual difficulties.
It's like carrying this extra burden.
It is.
That makes an already sensitive topic even more challenging.
Absolutely. And these cultural influences are pervasive.
Yeah.
They impact everything from how women view their bodies to their comfort level discussing sexual matters openly.
So I imagine this is particularly relevant for women from cultural backgrounds,
Oh, absolutely.
where sex is considered taboo,
Yes.
rarely discussed openly.
Right. So as healthcare providers, we need to be acutely aware of these cultural sensitivities.
Yeah.
It's about approaching these conversations with respect, understanding, and a willingness to meet our patients where they are.
So it's about recognizing that the experience of sexual dysfunction isn't solely confined to, like, a woman's individual biology or psychology,
Right.
but is also deeply intertwined with the larger social context in which she lives.
Exactly. And this realization underscores the importance of advocating for greater openness and acceptance surrounding female sexuality, challenging those harmful stereotypes, and promoting a more inclusive and empowering understanding of women's sexual health.
It's about changing the narrative, moving away from shame and silence,
Yes.
towards open dialogue and empowerment.
Absolutely.
Well said. This deep dive has been truly eye-opening, shedding light on a topic that's so often misunderstood and neglected.
I agree.
As we wrap up, what's the one message you want our listeners,
Yeah.
those GPs on the front lines, to walk away with?
I think the most crucial takeaway is this. Addressing female sexual dysfunction is about so much more than just managing symptoms. It's about seeing the whole person, understanding her unique experiences, her relationships, the societal forces that shape her life.
Yeah.
It's about creating that safe space for those honest and open conversations, offering compassionate, individualized care, and ultimately empowering women to take control of their sexual health.
Beautifully put. It's a powerful reminder that we have the privilege and responsibility to make a real difference in our patients' lives.
Yes.
Thank you for sharing your expertise and insights on this vital topic. And to our listeners, we hope this deep dive has equipped you with a deeper understanding of female sexual dysfunction, the tools to approach it with sensitivity and confidence, and the inspiration to be true advocates for your patients' well-being. Until next time, keep diving deep.